The initial evaluation of hypertension is really directed to identify complications of hypertension or comorbid conditions, such as CKD. The reason why this is important in initial evaluation because it influences the management that you do. The new diagnosis of hypertension is technically defined as a sustained blood pressure of more than or equal to 130 systolic or more than or equal to 80 diastolic. Some guidelines is 140/90 as the threshold for a proper diagnosis. In addition to atherosclerotic disease, a lipid panel is generally really recommended for men over the age of 35 and women the age over 45. If a patient is overweight or obese, you definitely have to screen for diabetes with a fasting blood glucose, or you can get the HbA1c. On top of this, get an EKG because you want to look for any left ventricular hypertrophy or even a prior MI. There's 4 basic tests that you should look for as far as laboratory evaluation of hypertension. Number 1 is renal, number 2 is endocrine, number 3 is cardiac, and the 4th is categorized as other. So for renal tests, definitely get the serum electrolytes, sodium, potassium, calcium. Creatinine is very important as well. You want to rule out any type of chronic kidney disease. Urine analysis is important to look for also any kidney damage or proteinuria. And lastly, the urine albumin creatinine ratio is also optional. The reason why you can get urine albumin to creatinine ratio, or the ACR, is because it really helps identify kidney disease if you have microalbuminuria, and it's a common complication of diabetes. The endocrine tests would include a fasting glucose, or HbA1c like I mentioned, a lipid profile, and the TSH, because this can elevate your blood pressure. In cardiac tests, EKG, and dependent on that, you can also get a cardiology follow-up with an echo. And the last category is other tests. So it's important to get a CBC, and also you can get a uric acid. The reason why you can get a uric acid test is because basically uric acid can cause oxidative stress. And what happens is the endothelial cells will decrease nitric oxide. When this happens, you have the inactivation of plasmin renin and angiotensin activity, causing kidney vasoconstriction or even ischemia, and of course, hypertension.